name is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach, and this current series we're doing on blood sugar and how it affects the body in general. We're talking about dysglycemia, we're talking about adrenal function, brain function, all these different functions. In this video I want to talk specifically about the thyroid gland. Now there are two major ways, actually three major ways that blood sugar can affect the thyroid gland, and I'm going to kind of allude to them as we go through this video series. But one of the areas is direct correlation with glucose and how it responds. So basically, again, you have normal ranges. In dysglycemia, we're talking about when sugar rises, it goes too high, comes down too low, back and forth. Now, the general rule is that cortisol tends to follow glucose. So if glucose goes high, then cortisol is going to go high. Cortisol is an effect of the adrenal gland, so that's one of those things we talked about in that previous video where your adrenal glands and your blood sugar are intimately related and can cause stress on the body. If cortisol goes high and blood sugar goes high, the thyroid actually goes low. So they counterbalance each other. So these functions can go up and down like this, and then when these go down, that causes thyroid to go high. So this can actually be an effect when this is happening. With not only does it fatigue the adrenal glands, it can also fatigue the thyroid gland. It can also cause dysregulation because remember, your hypothalamus sends a message to your pituitary to send a signal to the thyroid, to the adrenal glands, to the ovaries, to the testes, to all these different areas of the body. If this is constantly going up and down, and these signals are coming back to the hypothalamus, and it's constantly having to go up and down in its function, it can become dysregulated. So way number one that blood sugar affects the thyroid is directly with the up and down effect and the up and down effect here. Way number two that affects it is coming over here. The hypothalamus can become dysregulated. And mechanism number three gets into hormone imbalance, which you can watch the hormone video. But if you get into estrogen dominance, estrogen really likes to bind to thyroid binding globulin, which can greatly affect the conversion of T4 to T3. So blood sugar, major effect on the thyroid, just like it is on the adrenals and the brain and the gut. So again, this is a deal breaker. You've got to stabilize blood sugar, you've got to get it regulated, or you're going to have problems. All right? Please feel free to post any questions or comments below. If you have anything else you'd like me to shoot a video on, please feel free to post that below. And I look forward to hearing from you. Have a great day.